Hi, I'm Lori McLeod. I'm an assistant professor of behavioral science at the University of Kentucky Markey Cancer Center. So I study hope in cancer, specifically how we can build hope and the impact that hope can have on people's quality of life and mental health. I want to help people tap into hope during treatment for advanced or likely incurable cancer. One of the programs we've developed tries to do this by helping people think about personal or everyday goals that matter most to them and how they can get there. We help people think about what could get in the way, how they'd respond, what they would do if it seemed like their goals really were blocked because of cancer. Too often, when people are handed a difficult diagnosis, we focus all our attention on their treatment, and the other parts of themselves that are important get really small. Our program aims to broaden that world again, to create just a little more space for people to make sure they're doing the things that matter most, and that we don't lose sight of that while they're going through treatment. To help people remember that cancer doesn't get to rob them of who they are. And people are setting all sorts of goals, from big bucket list type goals to getting out of a wheelchair, to improving relationships, to keeping up with the home and mowing the yard. And these things matter. These everyday things matter. They make us who we are. They make up the stories of our everyday lives. My hope for cancer care is that if we all work together, researchers, doctors, clinicians, communities, we learn from patients to understand how cancer symptoms, treatment side effects, and disease itself are interfering with a person's life, whether it's their work, their family, their social life, including those critical roles and identities that they cherish most, including the things they're afraid of losing, that we'll be able to treat the whole person and keep sight of what makes treatment worth it in the first place.